Well, seems here in the last couple of weeks there's been all sorts of stuff. I just known lots of people that had some, uh, surprise medical type things need to happen, and it's just I've just decided that do you think the healthcare industry is the last Wild West? Seems like there's a lot of shooting from the hip that happens depending on where you go and what day. I had one buddy that had a pretty similar situation as Big Mace here, and he got told it was the Big C like 3 minutes in, and they had him scheduled for everything and, getting on medication for all that. And then come to find out it was, I'm not going to say nothing, but it wasn't the Big C.
Right.
And then, Big Mace has a real similar thing, and they look at him and send him to an MRI 2 weeks later, and we'll get a hold of you one of these days. And
Yeah, well,
hopefully we don't lose your number.
we'll let you know, and hopefully get that cut out here before it gets, big as a basketball on your ankle. But
and get my fat ass down there for my face thing. Oh yeah, that looks like one of those. We need to get that off of there. And I said, okay, let's do it. He's like, well, we're gonna have to. God dang it! What do you call it? The sample. What do you call that there?
biopsy.
A biopsy first. We got to send that off. I said, well, you guys do the thing here where you can see. Yeah, we still got to send it off. It'll be a couple weeks. We'll get there. And it's like, well, what the hell? Who's making the rules to this? It just doesn't seem like there's a lot of like
Insurance and insurance companies dictate our healthcare in America. You talk to any doctor. Well, I can't paint with a broad brush and say any doctor, but I would say most doctors would tell you that insurance companies prevent them from giving the adequate care that that patients deserve. And I know there's a big debate, and we don't dip our toes in the political waters, but when you have people that argue for the universal health care, you're realistically our government-sponsored healthcare, you're looking at it through these lenses, but it's done by a non-government organization, which is these insurance companies.
Yes.
Because they dictate what, when, and how. It's just like my foot.
Big pharma.
It's just exactly like my foot. The podiatrist recommended an MRI, but he said, before you can go get that MRI, you got to go through physical therapy, you got to go through this NSAID, and oh, by the way, you got to wear this walking boot. Come back in 2 weeks, and then we can decide from there. When instead it just could have been like, hey, go get this done. We'll take a look. If it's nothing, we can figure it out and plan. But then for stuff, like the bad thing of it is
you must have just worded it wrong. You should have just told them that you were having extreme nerve pain, and they would have just sent you right in through there, hot shotted you right through there.
Yeah. But I think the other thing of it is like for some other stuff that you could do, and they've started to do, like, for instance, the rate of colorectal cancer deaths under 50 is one of the fastest growing cancer deaths. But insurance won't let you at 40 go get one. You got to be 45.
You have to be 10.
Why don't you start that son of a bitch at 35?
You have to be 10 years prior to your closest relative's diagnosis date. So that means if my dad,
if he was 45, then you could do it at 35.
Yeah. 10 years. So it has to be your closest relative. So like it wouldn't matter. Like your grandparent don't care. Your uncle don't care. Your, whatever don't care. It has to be your parent. Your mom or dad has to have a colorectal cancer diagnosis. And at 10 years prior to their diagnosis date is when you're supposed to start, that's when you're supposed to start your colonoscopy.
But what I'm saying is
because I wanted to start sooner, because I've had plenty of turd problems before, and I thought, and my parents, both of my grandmothers died from colon cancer.
Yeah,
my grandfather almost died from colon cancer on my dad. Wild Bill, he almost died from it. So I wanted to get a jump on it. That's what I talked to my family doc, and I'm like, is that something that we need to start? And he's like, well, they won't. Like, you can't, not yet.
Well, and like the word, so there's been a lot of,
So that's where they give you those poop sticks.
You know, the old ship box that you send back with
Yeah.
UPS.
Yeah.
have you done one?
You finger paint with your poop with a little stick. No, I've not. No, hell no.
Oh.
That's weird. No, no way, man.
Well, I mean, you're talking about Cologuard, like,
Right. Yes. I mean, you can do that. It's very, very proactive. Like when we go to our health fair at the city, they give us a kit every year. I just haven't done it. Maybe I should.
oh,
Yeah.
that's like,
Have you? Yeah.
So, like, I think on our side, when Papa Frank had his first one, I mean, he had a lot of polyps. But see, like Grandma Lindemann, I think she had colon cancer issues, and then I think Grandpa Lindemann, same deal.
Yeah.
Um,
Our buddy Arlo, his dad's dealing with it. I mean,
Yeah.
we've talked about that before. I mean,
Yeah.
poor Bob, he's been through the ringer with that stuff.
yeah,
I mean,
and it's
tough
brutal.
spot.
Well, and I had a buddy I went to law school with. I think his uncle battled it like 7 years.
Just like everything else, man, early detection is the key.
Well, and that's what. So I was getting to it. Needed to get to it faster. A lot of these companies are developing these blood tests because these tumor markers shed proteins in the blood, and like the one that they have that you could possibly do that insurance won't cover unless you're a high risk person for it. It's like $1,000,
Wow.
and it's the blood test of it. So why would it not be cheaper for you to have the preventative blood test done than to wait until you need all this other stuff? Like I know when Mom had her, like one of the shots that they were going to get. I mean, obviously it didn't work, but one of the shots that was supposed to help alleviate some of these problems was like $10,000 a shot.
I think the one that gets me all the time is whenever you hear about people going in for exploratory surgery. You know what I mean?
Mhm.
Like,
We'll just guess.
what
Like,
the hell are you? What are you exploring? You know, that's like this thing I got to have on my foot. You know, that the doc that I've been seeing, he's like, yeah, I'm going to be actually accompanied by a tenured physician that's been doing these nerve release surgeries for over 25 years and have actually taught these procedures.
It's just gonna be two guys releasing on you.
Yeah. Okay, good deal there. Can't wait for that to go viral.
make sure you wear your glasses during.
Thank God I'm going to have a tube down my throat so all the other shit
Yeah,
can't
you
get
will.
in there. But the thing is like they like
Make
this-
sure they dip out a little petroleum jelly to make it
Good
easier for you to
Lord
tolerate.
Almighty.
the guy's been teaching this procedure on an international level forever, you know, and he's like, yeah, man, you got some major big blood supplying vessels that run on the inside of your ankle. You got 4 different nerve tunnels that run through there. He's like, his exact words, we're going to be messing around with some shit. You know what I mean? Like there's going to be some stuff in there, you know, that we got to keep an eye on. But he's like, we do it all the time. It's very common. And, you know, it'd be about an hour and a half and you'll be in and out. But it's like, you know, the people that like you say, you know, it's a wild west. I think a lot of these things, you know, in the cancer world, you know, we talk about the big C, but a lot of these, you always hear about exploratory medicines and this trial deal and, oh yeah, we're going down, going to try this and try that, you know, and it's like, I know modern medicine is changing, you know, day to day, really, case study to case study, but I know we don't want to dip our toes in this whole big pharma stuff, but man, it's pretty spooky. It's a pretty spooky conversation to have. Something.
You think that there's some patents locked away in some?
You're telling me that we can put men on the moon?
Allegedly.
Allegedly, we can put men on the moon,
And Helen Keller can read and write.
and we can take a hog's heart and put it in my body and make it work.
for about 3 to 6 months, maybe.
But we can't figure out how to cure cancer. We can't figure out how to cure diabetes, or, you know, at least make it to where, you know, insulin doesn't cost $50 million a month for people that have to have it to live. You know what I'm saying?
I'm sure that we can, but there's some level of, I mean, a lot of it's, I would say most of it's money, and some level of it's probably population control. You imagine if there was no,
No, that's
or very
you're
little
right.
terminal issues out there,
Yeah.
but Yeah, I'd say it's just social and money reasons are the only reasons we don't.
Yeah,
I'll say-
without a doubt. And for them to tell us that it's not that,
Yeah, it's
that's the shit.
Well, it's what I don't know.
Home's where you make it.
Well, I guess my thing of it is I've been down that rabbit hole personally where you wonder why, how, what, how it's different for one or the other. But you can get ratcheted up with that. But I think that we're probably closer now than what we've ever been. And I know that sounds dumb, but think about a lot of the immunotherapy stuff, a lot of the isolation of
Stem cells.
certain proteins that they do.
Don't forget about stem cells.
Yeah, they're important. But I mean, I get it. I mean, I understand what you're saying, but some of that stuff, like, we can't affect. You know what I mean? Like, some people let it eat them up. We can't affect that.
No.
Pfizer don't care what we do.
No.
They just want us to be Travis Kelce fans because
No
he got
shit.
the old. Think about how some of these.
Do they still do the? Are you talking about the?
Oh, they still push the COVID.
Oh, God.
Yeah.
Oh, there's still vaccines for that, huh?
Oh yeah, they want.
I
If
listened
they
to a
had it your
podcast
way,
today
you'd go get it every 3 months.
I'm
I
wondering-
say I
so I
listened to a
never got
podcast
sick.
today that there was every fourth commercial was about another COVID.
So I
vaccine.
used to never get sick but once a year, but I had like 3 of those things, and I'm wondering if that's why I'm falling apart now.
Well, you would have
We're really tiptoeing along here.
you
on
would
our
have
old YouTube buddies.
you would have cardiomyopathy if you had anything.
Well, there's a lot of other things to it.
Yeah.
We could go into that rabbit hole deep, and we may have to off air, but
yeah,
we're real close to the old. I mean, if we earned a YouTube strike, like, that'd give us a little bit of street cred, wouldn't it?
I
yeah.
don't know. What would you get a strike for?
Well, some of the tech overlords and couch guys over there got a hard on
Yeah,
hearing about this.
foaming
but
at the mouth.
they would misinformation. I mean,
Oh, that's what got old Rogan in trouble.
Yeah.
He said it was bullshit. Yeah.
well,
Ivermectin.
and then, but what's amazing is you wait 6 to 9 months, and all of a sudden things come out where it's like, because a lot of
Damn.
what people don't realize about science is a lot of trying things and seeing
all
what works
trial
and
error.
doesn't work. So a lot of
Yeah,
medications,
kind of like what the whole this whole topic is about. Like
The
it's
Wild
just-
West.
It's just
well, and it's
trial and error.
It still is, but so think about some of these common drugs that we have. Like Viagra was actually, I think, meant for something for your heart, wasn't it?
Oh, blood pressure.
Margarine was to fatten up turkeys and chickens for slaughter.
What is?
Margarine. Like artificial butter.
Oh,
Country crock.
yeah, we don't use that. We use just butter. In the
I
household.
grew up on country crock.
But you could use like certain antidepressants help with nerve pain and neuropathy and
that
The diabetes, it's a weight loss thing now.
Ozempic?
subglumatide or whatever the hell that shit's called.
Yep.
Schmegmatide.
Schmegma. Sorry, guys. I guess I didn't realize I was getting us off on YouTube strikes when I was.
No way.
No,
This
you're not.
propranolol medicine that they wanted to use for my
Sticker?
for the
palpitations.
the heart palpitations. It's a rhythm medicine that they said that it was made for in the beginning.
get rhythm.
It was made for a treat heart problems with some symptoms. It also can be used for anxiety and migraines.
Yeah.
So, like, I would use it for rhythm issues, but then somebody else could use it for.
Seems like
anxiety.
maybe you'd cause a different rhythm in the person that had a migraine. So you fix the migraine.
That's what I'm
Just give
saying.
them
That's
something else to
what
worry
I mean. That's why.
Because what was Botox? Botox was created for something else, and then they found it to be used for the plastic surgery purposes that it's used for.
Development of Botox began in the late 70s as doctors identified an injectable substance that would weaken the something eye muscles in patients as a alternate to muscle surgery.
Yeah. So I don't know. It is the trial and error, but I think with artificial
Oh,
intelligence,
it was sorry, Casey. It was originally made for people with cross eyes. Botox.
Yeah.
It was used to correct cross eyes. Ain't that weird? Huh?
What's it from Oh god.
Adam Sandler.
No.
Whenever Tina Fey's got that one real rogue ass eyebrow, that is probably one of the most. Jennifer Aniston was losing her shit that entire time.
I was just thinking of that. Bobby's mother.
Bobby's mother.
Oh, there you go.
He's cross-eyed. I want to be ninja. If you don't watch Bad Friends podcast, shout out Bobby Lee. You need to check those guys out. That's hilarious.
That is a big tough spot.
But no, I don't know, man.
That's just where I was at.
AI.
Oh,
I think artificial intelligence is what
spooky.
they're using AI now, like when it comes to cancer treatments, everything else. And I think maybe that's where the medicine was possibly ready, but the technology and figuring out what it would work for wasn't caught up at the time.
I'll buy that.
You know what I mean? Because with the artificial intelligence, because now you can put all this gene sequencing code stuff into the old magic box and it'll tell you, almost the predictive behavior of it. It's only going to increase the care and
That's how
ability.
babies are made.
What?
The old G sequencing in the old magic box.
Huh.
Mm.
Be darn.
There we are.
That's nutty.
Yep.
You'll know all about that by the time you get out of the old.
Once them doctors are done releasing.